Hi friends, and welcome back to my channel. Happy New Year. In today's video, we're going to be talking about some successful tips on how to turn a bad clinical day into a positive new learning experience. Because let's be honest, we've all had bad clinical days, whether you're a first-time nursing student, experienced nursing student, or even a nursing educator. We have all had those days and those moments that we would love to forget about. But my focus today is really for my student friends out there. So think of this as your big sister nurse educator advice to those of you who are sitting in the nursing student role right now. Let's talk about you just had a really bad clinical day. How can we make it a better one? So maybe think back to your fall semester or a previous time that you had at clinical where things didn't necessarily go exactly as planned. And then you got that clinical evaluation form back from your nursing faculty member, and maybe you were a little shocked to read the feedback or see what it was. And instead of looking at that as an opportunity for growth, maybe you really got stuck on the negative part and had a hard time overcoming things. So let's just talk through some helpful tips that you can do to really make that a positive learning experience that ultimately is going to help you grow. Because if you always do what you've always done, you'll always be where you've always been. And the whole point of nursing school is to get you to grow and continue to succeed and eventually pass boards and be a wonderful nurse. All right, so let's backtrack. You get the clinical evaluation and it's not exactly the news that you wanted to read or the things you wanted to hear about yourself. Let's think about that for a minute. Chances are, if you're being honest with yourself, you probably, when you think back on your day, the day that you got that feedback, you probably know that you did some things wrong. Be honest with yourself. And sometimes that's difficult for us to do because we don't like to focus on our failures or, those times where we're like, oh, that was a cringeworthy moment. But again, we grow from those moments. Honestly, we do. So that's my first piece of advice, is really be honest with yourself and think back to that day. How did you perform? Were you focused? Were you working through things, utilizing critical thinking, all of that? So the next part of that, after you've been very honest with yourself, I think it's important to look at whatever feedback you got and say to yourself, there's two pathways that you can take. You can either take this as an opportunity for growth, or you can look at it negatively and be stuck on that and be frustrated and just carry that around with you internally. We don't want you to do that, and you probably really don't want to do that yourself. So let's take the other path and look at it as an opportunity for growth. So when you head back into your next scheduled clinical day, go into that with that mindset that you're going to be very intentional. You're going to set some goals for yourself. What are 5 things, whether they're big goals or small goals, that you want to accomplish that day that really combat maybe the negative behaviors that you received some of that feedback on? So for example, maybe it was your turn to pass meds, and maybe you honestly and truly just were not prepared. Maybe you were really nervous and you started to crumble under the pressure. It could be many things. So using that example, the next time you're at clinical and you know that you're passing meds, you are going to be ready and prepared. You're going to look up all of those medications that you're giving. You're going to know the safe dose that you should be administering to that patient. You're going to know what those medications are used for. What kind of education would I be giving my patient? Are there any contraindications to those medications? And ultimately, how do they tie back to the pathophysiology of disease that the patient is in the hospital experiencing? So those are just all ways that you can be really ready to hit the ground running when your instructor comes and finds you and says it's time to pass medications. The next thing I would ask you to do with trying to learn from this experience would be working with whatever nurse you are assigned to as your primary nurse. Obviously you're all assigned a patient to take care of, and then that primary nurse is the RN taking care of the patient as well. Talk with them and let them know this, give them an example specifically and being honest with them of something that you got some negative feedback on, or maybe an area that you struggle on that you really want to work on this week. If you came to me and I am the nurse and you're helping to take care of my patients and you told me you struggled with medications last week, guess what I'm going to do? I'm going to grab you, whether you're passing meds or not. I'm going to grab you and bring you with me. We're going to work through that medication pass. I'm going to tell you in my, my methods, what works for me, how I would do things. I'm going to allow you to watch me. I'm going to allow you to come with me. And chances are you're going to learn a lot from that experience. So it's really great to communicate with the nurse for your patients because they can help you too in that learning experience. My next piece of advice for you is touching base with your clinical instructor. What I see on my end when students get some maybe negative feedback, which ultimately is constructive criticism to help you grow, instead of coming and talking to us, they might avoid us like the plague. Don't do that because it's honestly just going to be awkward for everybody. It really sets the tone for the day and for a positive learning experience when you, the student who needs to work on something, comes to me, the instructor, or whoever your instructor is, and you're honest and we had that conversation like, hey, I really struggled. I read your feedback. If I'm being honest with myself, I agree. I really wasn't prepared for meds, but I really want to make today a better learning experience. I'm still nervous. I'm still really stuck on that feedback from last week. I'm afraid I'm going to fail. Can we talk through this? You will feel so much better doing that. You'll probably feel the weight lift off your shoulders. And I, in turn, as your instructor or whoever your instructor is, will see that you're genuine, that you care, that you're sincere, and you're ready to learn and you're taking that next step as a student and taking responsibility. That is huge. Trust me. That is definitely a big step, a positive step in the right direction. The next thing that I would encourage you to do is find that person in your group that is really the strong student, because there's almost always leaders and then followers in the group. Watch that student, observe them. What are they doing? How is it that they lead? How is it that they're really well prepared? And what can you do to learn from them? You don't have to be them because you're your own person and you don't have to do everything the way that they do it. But chances are there's something that they do and they probably do it very well that you can take that opportunity to learn from that experience and try to model some of those behaviors and in fact continue to grow as a nurse. Next piece of advice for you is knowing what your clinical learning objectives are or your student objectives. They're essentially the goals of clinical. Why are you specifically there? What specific behaviors are we looking for you to be successful on and satisfactory on? Because if you don't know those behaviors, you're missing out on the whole point of that learning experience, because part of learning is preparedness. And in order for you to achieve the goal, you have to know the goal. For example, if that behavior is communication, what exactly is it under communication that we're expecting you to do? You should know those behaviors inside and outside. I think of clinical behaviors kind of like your rule book as a student nurse. Those are the things that I'm being evaluated on. Those are the things that I need to do in order to be successful. So the next thing that I would encourage you to do is really being honest with yourself, which again, sometimes can be hard to do, but take a moment to look back on that previous week's negative feedback, which also known as constructive criticism. And when you're writing in your student self-evaluation this week where you've showed some positive improvement, I want you to just take a moment and be honest and think about how you performed the week before and what you did differently this week. So we're going to go back to that example I gave of not being prepared for MedPass. So last week's feedback was you did poorly, you were not prepared, you could not educate your patient, you did not show side effects, and ultimately you just were not safe in passing medications. This week, you know that you took the time to research every medication you were administering. You knew the side effects, you knew the ordered dose, looked up the pertinent patient education, the potential side effects to make sure that nothing, was contraindicated with other meds they were getting or the pathophysiology of disease that currently was going on. And you as the nurse were able to have that conversation with the patient, the student nurse, educating them on these are the meds I'm giving you, this is why, these are the potential side effects, all of that. Your instructor gives you that little smile and wink because we're like, you got it, you're doing it, you're acing it. Yes, this is what we wanted. So it's time to fill out that student self-evaluation. And this is the part where I encourage you, look back on what was last week's improvement? Where did you need to grow? And really sit and think thoughtfully about how you did grow this week. How did you end up meeting that objective that you needed to improve upon? The more that you can tie those pieces together, you're going to see your own growth and it's going to boost your confidence and you're going to feel better when you're at clinical. And little by little, week after week, you are growing. And even when you still have questions, you're still unsure, and you still have so much to know, you're learning every time you're at clinical and able to tie all those pieces together. And part of the learning process, quite frankly, you have to be open to any kind of feedback, because that constructive criticism or the feedback that we all don't like to hear is in fact the feedback that does help us grow, and especially in a student role when you're trying to just become that successful future nurse. We want you to grow. Last thing I will say is go into every clinical with a positive attitude, because there is nothing worse than when you harbor this negativity from last week's feedback, you're frustrated, and it just continues to drag out throughout the semester. Just let it go. Eyes forward, constantly on the goal. You don't need to look back behind you. What happened last week was last week. Learn from it, grow from it, and it will help you to be successful. So hopefully you found those tips a little helpful, especially as many of you are getting back into the swing of things with the spring semester after being off for holiday break. And really just go into your clinicals this semester with that positive attitude and mindset that I'm going to grow and I'm going to be the best nurse that I can be. And I can promise you that you are going to have a wonderful learning experience each and every time. Thanks so much for watching. Bye.